Hey, Dr. C here with you. Let me read this question real quick. This one just came in. Hi, Dr. Christianson. I've seen several different suggestions for immunity kits people should have in case they get sick from any kind of virus. They all seem to be different. Some even have iodine in them. What do you recommend? Thank you so much for sharing so much information with us. This is from Tiffany H. So Tiffany, yeah, thank you for sending the question in. We got a lot of questions, a lot like yours. Many were about, in general, what should they take if they're feeling sick, if they're getting a virus, whether iodine is helpful to take if you're ill or preventive. And we realized we really had to address this, that this is a valid concern. You know, we don't have any treatments that are known to be effective against COVID-19. No one does. No one knows anything that does work consistently. So the question becomes, what do you do if you're just sick at home and you want to try to feel better and lower your chances for illness? You know, there's so many times in which we always need more data and we want more data and it's valid to pursue it, but we've got to make decisions today. You know, if you're home and you're ill, you've got to do something now. And it's reasonable to do the best you can with what we do know. And many are thinking about that in these same ways. So the IH docs and myself sat down together and we put together an antiviral protocol. And here's some criteria we thought through. You know, first and foremost, the people like you that we're speaking to most have thyroid disease. And there's a lot of things that can act on the immune system that could be useful, but could push you in the wrong way for your thyroid function. And not only is that important for your general health, but your thyroid function is critical for a good immune response and a lower risk for complications. So mandatory, it's got to be thyroid safe, thyroid friendly. There's also a lot of things that might work but don't have a lot of good safety data on them. Not safety data in humans, not safety data at the amounts that are being needed, and not really in situations in which there could be complications. So I always think about safety being so critical. And in medicine, this is just a whole different thing. Also, I wanted there to be some recommendations that could work well against a big range of viruses. You know, here's the thing. Most everyone who gets ill right now won't know for sure what they have. And many will have COVID-19, many will not. It is still a flu season. There are colds going around. Some even have seasonal allergies that get thrown in the mixture. And many that do have classic COVID symptoms are dissuaded from testing. They may connect with the doctor and the doctor says, hey, you probably do have this, but tests are at a premium. You don't sound like you're in a critical situation. You're better off not even testing. So most will not test. Even those who do test, most will do home treatment. They will be staying at home. So yeah, you won't necessarily know what this is. So this should work against a good range of viruses. Now, what are the biggest worries right now? Well, they really relate to pulmonary complications. So we wanted our antiviral protocol to be helpful against the risk of there being lung damage. The COVID-19 illness itself, it has a unique effect on damaging the interface between the lungs and the external world. And by doing so, that's where we get the pulmonary congestion, the cytokine storm, and the most dangerous complications. So we want to make sure that whatever we do is helping, especially lung tissue. And we've got to consider practicalities. So I've seen many protocols that use a lot of pills. There's some point at where taking a lot of pills, just the pill count itself, may be more harm than there is benefit. And it's a hassle. We also want to make sure things were reasonably cost effective and had a good shelf life, because this is a kind of an idea to where you want this like a fire extinguisher or something. You know, I hope you won't need it. And I hope it can sit around for quite a while and gather some dust. And in this case, though, someone in the household probably will get a viral illness over the course of the next couple of years. So these are things that have a 3 or more year shelf life. You can have this on hand. You can have it right there. And some thoughts too. Again, this has got to be safe for those with thyroid disease. It's also got to be compatible with thyroid medications and compatible with most medications people might be on. Now, not all. So if you are on some medications, you've got some chronic treatment, do check with your doctor, your pharmacist. Another thought is pregnant women, lactating women. You know, we just don't have data on nearly anything. So these recommendations will not apply to pregnant and lactating women. So please hear that. And again, this is not to say these things will kill COVID-19. We don't know that. but based upon the things we do know about your immune system, your lung function, how viruses operate, and putting all that together with your thyroid function, we think these are the most reasonable, convenient, available, cost-effective options. So a lot of hoops to jump through. Now, an important thing to think about is, when would you treat? When would you start something like this? Well, I'll talk a bit more about symptoms to look for, but the general idea is you'd want to start at the earliest symptoms. We know this, that in the case of flus or other viral illnesses, that if you're treating in the first 24 to 48 hours, you've got by far the best chance of being successful and making a big difference. So given that, you want to have this at home. You want to have this sitting around in your pantry somewhere. Right now, we can't drive to health food stores. Inventories are short in health food stores. We can't order and get things quickly online. So this is better to order, purchase ahead of time, have it on hand. We do have these in stock. We did also think through ingredients and items that weren't going to go into back order immediately. So we have these, we're shipping these safely, and these are available. Now, I'll talk through the individual items, but the general combination here, we've got a blend we formulated of botanicals and antioxidants. We've utilized a well-absorbed version of N-acetylcysteine, and we're also using oral immunoglobulins. So let's talk about the antiviral protocol and what this looks like and how it works. So I've got one here. I've not opened this up yet. And I'll do this safely to model good habits for these days. So first thing, I'm going to put on our gloves. You know, truth be told, this box did sit outside for 2 full days in the Arizona sunlight. So I'm pretty comfortable with the box, but let's say that it had not. Here's how I would be handling it. So open it up with the gloves. I always had a hard time at crafts and construction things. Okay. And we've got, we'll mention this, the Daily Reset Pack. That's relevant to our discussion. And we have the SBI support, N-acetylcysteine that I mentioned, and ViroClear. Now, first question is, why is there 2 of everything? Okay, so I'm setting the box aside. Now, I'm not going to open these products, but if I were to open them now, I would take a Clorox wipe and just wipe down those surfaces, open them up, take the stuff out. So that's safe handling. And I'll show you guys a cool trick. When you're all done using gloves and things like that, take whatever garbage you've got, put that in one hand. I'm holding from the outside and pulling over. Now I'm going to wad up the glove inside the other glove. See, I'm only reaching on the inside of the glove here. I'm not touching the outside. And I'm wadding that over, and voila. That's been thrown away. I've never contacted a contaminated surface throughout that whole process. So pretty cool thing. But yeah, general idea, that's how you'd handle that. Now, there's 2 here. You know, 1 is fine, but think about those on whom you are on shelter with. So we've actually got 3 that are on shelter with me, and soon to be 4 in another week or so. But if you're sick, if you're getting symptoms and you're sheltering with someone, the odds are pretty darn good that they are going to be getting ill very soon. So smart to have 2 on hand. We've set things up. You can do 1 or 2. The first thing I want to talk about is SBI support. And this is a mixture of immunoglobulins. Now, immunoglobulins, you hear about gamma globulin injection, immunoglobulin injection. These are well evidence-based and used for quite some time in medicine. These are important when we need to see an effect that's boosting the immune response. So this is used in the case of chronic immune insufficiencies, also in some cases to where there's genetic immune insufficiencies or infections the body cannot shake. So gamma globulin has been used in the cases of current COVID infections as well as an adjunct agent, but it's got a lot of use and well documentation for generalized immune support. Now, there are gamma globulins that do work orally, and some have better survivability of the intestinal tract than others. A limitation had been that most of those oral gamma globulins were dairy derived, and they were still containing active dairy compounds. Many with thyroid disease are avoiding dairy for various reasons, and that was a real barrier. There are also issues of iodine contamination in dairy products, so that made that a non-issue. But also in our work over this last month and a half to just scramble and hustle and find things to help, we were able to put together an active oral immunoglobulin that is non-dairy. So oral immunoglobulins are examples of passive immunity. When a baby's breastfeeding, the baby is ingesting immunoglobulins from mom's milk, and that gives rise to immunity. So even without an active immune system, ingesting immunoglobulins gives you a more active immune system. This has direct effects upon GI health, also direct effects upon whole body IgA. IgA and IgG are the main immunoglobulins that are present in SBI support, and they do survive the intestinal tract in ways that raise to your immunoglobulin load. So these help gut barriers, these help resistance in the intestinal tract and also the respiratory tract. These also been documented to have direct antiviral effects against a broad range of human viruses. And these are crazy safe. There honestly aren't known side effects with the exception of the dairy-derived versions, which can have side effects in relationship to those who have dairy sensitivities. So that's the SBI support portion. Now, next up, we wanted to include N-acetylcysteine. This is a sulfur donor amino acid, and this is a precursor that helps the body in the formation of glutathione. And oral glutathione, you could think, why not just take it directly? The data is a little hit or miss. I'm still not completely sold that oral is effective. It may be, there are some valid applications of it, but to date we have more data showing that taking N-acetylcysteine by mouth can raise glutathione production. Then we have data saying that just taking glutathione production survives the intestinal tract. The other nice thing about N-acetylcysteine, we've got a lot of research about its effects upon pulmonary health. There's a genetic disorder called cystic fibrosis, and the problem with it is that the fluids build up and thicken in the lungs, and that creates difficulty breathing and complications. And we've got good data that N-acetylcysteine is useful in those cases. There's also data showing that it's helpful with chronic emphysema and modeling the main complication risk with COVID-19. The main thing again is really pulmonary buildup of fluid and pulmonary consolidation, lack of airway perfusion. And N-acetylcysteine is well documented to thin the fluids in the lung and make the lung barrier more resilient and more healthy. So a real good fit that way. In terms of safety considerations, quite safe and well tolerated. There have been some studies in which really high doses of N-acetylcysteine were used, and some people in those studies would have nausea, stomach irritation. Not common in reasonable dosages, but that's the one thing just to be aware of as a complication. Again, more common at a higher dosing range. The last thought was we've got data about certain micronutrients, certain botanical compounds. And there's many options out there. Again, we wanted to be using things that were well documented, that had relevant mechanisms of action, good histories of human usage data, safe with thyroid function, safe with autoimmunity. So there are adaptogenic immune modulating herbs that may not have clear safety patterns for autoimmune states. But given that, we really wanted to focus on astragalus, sambucus, which is also called elderberry, andrographis, and echinacea. So those are the herbs that we chose. And again, always check with Dr. Pharmacist. These are safe with thyroid medications. These are not known to be safe with pregnancy and lactation. The last thing we wanted to round this out with was a few extra antioxidants. And these are fascinating because more is not better. A little bit can be useful, and higher amounts, really high amounts, are toxic, but moderately high amounts are less effective, which is not intuitive. Yeah, we always think that if a little does a little, a lot does a lot. But in the case of so many micronutrients, it's just not true. And these are great examples of that. Now, the antioxidants we chose were vitamin A, vitamin C, and zinc. And the thought is, remember, we want to be in that sweet spot. We want enough to help, but not too much to be less effective. So these things, they're not going to replace a multivitamin. So you still want a multivitamin, and all the micronutrients are relevant for your general health and your overall immune response. So we made this to be compatible with a good multivitamin like the Daily Reset Pack. And the vitamin A, the zinc, the vitamin C, it's compatible with this. It's a complement on top of it, but this doesn't contain the full range of selenium, of molybdenum, of folic acid, natural folate, all the things that are important. This won't have that. It is iodine free, but it's meant to be a complement for an appropriate thyroid-friendly multivitamin. So yeah, consider that. So the general protocol is these things are made to be used twice daily for 1 month. And capsule format, the SBI support, this is 2 capsules per dose. The NAC is 1 capsule per dose, and the ViroClear is 1 capsule per dose. The Daily Reset Pack is a pack twice daily. So the thought is you're just doing one of everything twice a day for 1 month. The Reset Pack is meant longer term for just ongoing micronutrient support, but we wanted to keep this really simple and not make it be too many pills to be a difficulty. So yeah, just two of these, one of these and one of these twice a day with food, and just take it with your multivitamin. And in considering those items, boy, there's a long list of nutraceuticals that we left out. And I talked about early along some reasons why. Some didn't have as many safety studies. Some were just not consistently available. There were some cool things that might have been fun, but we know they were going to run out of stock, or they already were out of stock. Or there was examples of some ingredients that might have been neat, but they wouldn't be compatible with things that had such good documentation. So we wanted a nice mix that would play friendly and work well and be compatible with the multi. That's the thing too, is that if you've got too much of certain micronutrients and you're on a multi, now you're outside of that effective window. Now you've got too much to work well. And if you leave out the multi, you're missing a whole lot of good things you should be getting. So yeah, this should be compatible with an appropriate multivitamin. And when do you start this? Well, kicking this off really at the earliest symptoms. And we're thinking about things like dry cough, fever, fatigue, loss of sense or smell can be one of the earliest symptoms too. Unexpected diarrhea can be a big one. Fever elevation, body aches and pains, sore throat. So if these things show up, time to jump on the antiviral protocol and do that for 1 month. Now a pitfall is your symptoms might clear up really quickly. And it might be the case that the protocol helped you. It might have been the case your body was going to kick it off anyway in the first few days. But still do a month. What we've seen about this current infection is that people often have radical fluctuations in their symptoms. They seem to do a lot worse in the first few days. They often get better. And they feel like they're in the clear, and then maybe a week out it hits them like a freight train. So don't assume that you're clear because you've gotten a bit better. Take these things for a full month. Stick with the time frame. Now to address Tiffany's question, so why no iodine? Well, I've talked a lot about how iodine can throw off your thyroid function. There's that, but it's even deeper than that. So there's good data saying that on surfaces, iodine can kill the COVID-19 virus. And we know that bleach products, Clorox bleach, we know that these types of things as well can work. Well, the funny thing is that iodine and bleach are chemical cousins. So bleach works because of the chlorine present in it. This is chlorine dioxide. And chlorine is a halogen, and it is a free radical generator. So it generates high amounts of unpaired electrons on contact. And that's why it kills bad things. But that's also why we don't make bleach cocktails. And that's also why you don't put bleach on your skin. You don't drink it. It's poisonous stuff. Now, iodine is a nutrient. We need tiny amounts of it, but the amount needed to act like bleach is in bleach-like concentrations that are not even in the ballpark of what's safe for human usage. So the same reason you don't take bleach to kill infections, even though it works really good on surfaces, that's why you don't take iodine to kill infections, because it's the same compound, it's the same chemical family, it's a halide. And yes, it's really effective at sterilizing surfaces, but no, those amounts are not at all safe for human usage. The nutritional ranges for iodine are literally hundreds and thousands of times lower than the amounts needed for having an antiseptic effect. So if you were to get enough, it would be horribly toxic and completely disrupt your thyroid function. If you were getting less than that, it wouldn't be effective as an antiviral, but it could still easily be great plenty to disrupt your thyroid function. So A couple of thoughts, again, over the course of this next year, several months, the odds of any one of us getting sick are pretty darn high. I'd rather you be well, and I'd rather you be healthy and have lower risk for complications. But truth be told, we think that before the year is out, half of us or more will be sick. And if not this year, next year. And if not you, a loved one. So this is to be expected. And hopefully we'll have more access to easy shopping and stores opening up, but right now that's not the case. You can't safely go out and pick up what you want, and if you do go out, you can't know that things will be available in inventory. So we've got these on hand. We are shipping these. You can have this at your home in a couple of days. We are safely packaging items. So in our shipping department, masks, gloves, sterilizing all surfaces that we're touching, closing things up, and even then, packaging and labeling, so things are done in a safe fashion. Still take precautions, leave packages out before you access them, utilize protective equipment as you're opening any package that comes into your house, whether you got it from the mail, whether it was a carry-out that you picked up, whether it was a delivery from a courier service. Be cautious about those items. But many of us will get sick. Most cases there won't be a clear diagnosis. Now, if you are somewhere to where you're pretty sick and you're not sure whether or not you should be tested or hospitalized, you do have the options for a telemedicine consult. So the IH docs have special visit times set aside. They can help you make sense of your symptoms. If your symptoms would warrant further evaluation or testing, they can help coordinate that for you for whatever state you are in. The other really cool thing that's being available right now is that if you are also due for following up on your thyroid care, we've worked really hard and done validation studies over this last month to have accurate, safe home testing for you. So you don't get results at home, but you can do a test collection at home. There's a kit we can send out to you. You poke your finger, you put a drop of blood on a piece of paper, you drop it in the mail, and you're all done. And we get accurate, meaningful results for your thyroid levels or for your hormone levels if you're on some version of hormone treatment. We can also evaluate iodine status via safe home testing now. This has been something I've wanted for so long, just some accurate way to gauge an adult's level of iodine, not a population level, but a person's level, and we now have that can be done at home. And also Thyroid Med, the pharmacy, we can cover you that way, get things shipped, taken care of for you, and meet with you in your home via telemedicine. So this is a level of preparedness that I would encourage. Truth be told, I wanted the box to have as a demo for the video, but also I wanted to have these things at home. So we got it all done. I told the team, I said, hey, I should have a box to do in the video for a demo, shouldn't I? Wouldn't that be a good idea? And I'm thinking, I want these here. So truth be told, I had a hidden agenda in getting that box sent out. But I've got it, you can have that, you can have some level of security. But this is a big deal. And do know if your symptoms are major, it still can take evaluation and follow through. But Dr. C here with you. We're going to get through this thing. I've actually been really encouraged as of late because the earlier projections were based upon the earliest data, but now that we've gotten more data, some of our fundamental thoughts about just the rate of contagion, the rate of hospitalization, the rate of complication, those fundamental ideas have shifted, not huge amounts, but small shifts way down here can lead to large shifts way up here when it comes to the projections. So we're not expecting it to be as pervasive as it was thought. I think in terms of disruption of our way of life, probably for years. But in terms of the level of restriction we have now, I don't think we've got long to go. I really think that by late spring, early summer, we're going to see a lot less restriction in our social activities in most parts of the country, most parts of the world. So that's really encouraging. So stay safe. Let's ride this through. And if the flu, the cold, anything else does come up, let's be prepared. All right, Dr. C with you. Take great care. I'll see you soon.